Good day, we are from Group H and our video is about acute otitis media. This is the anatomy of the ear. The ear can be split into three parts: external, middle and inner. Middle ear lies within the temporal bone and extends from the tympanic membrane to the lateral wall of the internal ear. This is the epitympanic recess, which is the space superior to the tympanic cavity, which lies next to the mastoid air cells. Malleus and incus partially extend upwards into the epitympanic recess. Eustachian tube helps to equalize pressure between the outer and middle ear. Sound waves heats and vibrates the tympanic membrane, which moves the ossicles. Stapes causes cochlear fluid to vibrate, and cochlear cells translate vibration to nerve impulses and sends them to the brain, where sound is perceived. So this is the definition of acute otitis media. An acute suppurative infectious process marked by the presence of infected middle ear fluid and inflammation of the mucosa lining the middle ear space. These are the common bacteria, which are Streptococcus pneumoniae, non-typable Haemophilus influenzae, and Moraxella catarrhalis. And the route of infection is via the eustachian tube, which is the most common, and via external ear. URTI causes inflammation of the respiratory mucosa, which causes obstruction to the eustachian tube isthmus. Obstruction causes accumulation of secretion in the mid-ear. Air from the mid-ear is reabsorbed into the circulation, creating negative pressure, which pulls bacteria or viruses into it, infecting and inflaming the mid-ear. These are the stages of acute otitis media, starting from tubal occlusion, pre-suppuration and suppuration. These are the pathology, symptoms and signs. Next, there's resolution, and lastly, the complication stage. These are the risk factors: age less than 2 years, previous URTI symptoms, atopic diseases, chronic sinusitis, ciliary dysfunction, nasopharyngeal tumor, cleft palate and craniofacial anomalies, childcare attendance, and immunocompromised. Children are more susceptible to get middle ear infections due to their anatomical structure, underdeveloped immune systems, and children of age 2 to 6 start to go to kindergartens, hence they have high chances to get infection from others. Signs and symptoms can be divided into specific and non-specific. Under specific, there's otolgia, otorrhea, dizziness, hearing loss, tinnitus, vertigo, facial nerve palsy, and mastoid swelling. Under non-specific, there's fever, vomiting, diarrhea, anorexia, and irritability. Otoscopic findings are bulging or retraction of TM, erythematous, inflamed or whitish discoloration of TM, light reflex, dull-looking TM, signs of perforation, effusion, prominent lateral process of Malleus, and bullae formation. So these are the pictures to illustrate the inflamed, bulging tympanic membrane, the whitish discoloration, and also marked erythema, air fluid levels, and bulging tympanic membrane. Investigations can be divided into two: hearing assessments and imaging. Under hearing assessments, there are bedside assessments and audiological assessments. These are the imaging investigations to check for complication, erosion of bone with intracranial extension, or unusual lesions. Complications can be divided into two: intracranial and extracranial, and extracranial can be further divided into intratemporal and extratemporal. For the management, medically, decongestants can be prescribed, anti-allergics such as antihistaminics, antibiotics, and middle ear aeration. Surgically, myringotomy and fluid aspiration can be done, grommet insertion, tympanotomy or cortical mastoidectomy, and surgical treatment. That's all from us. Thank you.